Hello. Today we are going to discuss the 12 cranial nerves, what they are, what they do, and I'm going to give you a few ways to remember them. Cranial nerves are the nerves that originate from the brain or the brainstem that relay information to and from various parts of the body to the brain. There are 12 pairs, meaning they occur bilaterally in the brain, and they are numbered with Roman numerals based off where they emerge from the brain from front to back. The nerves have one or two different types of neurons: afferent or sensory neurons that carry information towards the brain, and efferent or motor neurons that carry information away from the brain, only with a few of them having both types. So cranial nerve number 1 is right here, and it is the olfactory nerve. It originates from the cerebrum, and it is the sensory nerve responsible for the sense of olfaction or smell. Cranial nerve 2 here is the optic nerve. It also originates from the cerebrum, and it is also a sensory nerve, and it's responsible for vision. Cranial nerve 3 here is the oculomotor nerve. It originates from the midbrain, and it is a motor neuron that plays a role in eye movement, but it also influences eyelid elevation, pupillary constriction, and lens accommodation. Next, we're going to go to cranial nerve 4, which is the trochlear nerve. It originates in the midbrain, and it is a motor nerve, and it is responsible for eye movement as well. So we're going to skip 5 for just a second because we can group nerve 6 with nerves 3 and 4, and this is all going to make sense when I show you the next step in just a second. So cranial nerve 6 right here is called the abducens. It originates in the postmedullary region of the brain, which is a space between the lower border of the pons and the superior border of the medulla oblongata. And it is a motor neuron, and it's responsible for eye movement, particularly moving laterally into the outside or abducting, hence the name abducens. Now back up to cranial nerve 5. It's this large one here. It is the trigeminal nerve. It originates from the pons, and it is the first of the cranial nerve that has both of those types of neurons that we talked about earlier. So sensory wise, it deals with the sensation and sensory functions in the face, and the sensation in the anterior 2/3 of the tongue. Motor wise, it has responsible for mastication, which is chewing and biting. So now we're going to go back down to nerve 7, which is the facial nerve. Nerve 7 originates in the postmedullary region, and it also has both type of neurons. Sensory wise, it is responsible for taste in the anterior 2/3 of the tongue, not to get confused with nerve 5 that is responsible for sensation in the anterior 2/3 of the tongue. And motor wise, nerve 7 deals with facial expressions, closing your eyes, and salivation and lacrimation, which are the production of saliva and tears, respectively. So number 8 here is the vestibulocochlear nerve, or the auditory nerve. It originates from the postmedullary region, and it is a sensory nerve that deals with balance and hearing. Number 9 here is the glossopharyngeal nerve. Excuse me. It originates from the medulla oblongata. It has both functions. Is the sensory functions of taste and sensation in the posterior 1/3 of the tongue, the pharynx sensation, and chemobarrier receptors. And its motor responsibilities are functions are swallowing and salivation. Please forgive me. I have a head cold. Number 10. The vagus nerve is called the Great Wanderer because it influences lots of parts of the body. It is the largest of all of the cranial nerves. It originates in the medulla oblongata, and its name actually comes from the word vagrant. It has the sensory responsibilities of sensation in the skin around the ear, the pharynx, the larynx, and the thorax, and the abdomen. And it has taste and sensation of the epiglottis. The motor functions are swallowing, speech, and coughing. And it also has the parasympathetic function of decreasing heart rate, increasing gut mobility, and sweating increases from the vagus nerve as well. Number 11 is the accessory nerve. It originates from the medulla oblongata and the cervical spinal cord, which is why it's sometimes called the spinal accessory nerve. And it has the motor function of shrugging the shoulders and turning the head. And last but not least, we have the hypoglossal nerve. It originates from the medulla oblongata. It's motor nerve from glosso means tongue and hypo meaning under. So this nerve deals with tongue movement of the muscles under the tongue. So now that we have reviewed all the nerves, I only know one mnemonic and it is very naughty, so I am not going to share it with you, but there are several that you can look up and use. But one thing that I do find helpful is the cranial nerve face man. So you are going to start by drawing, where's my cursor? There we go. One nose. The cranial nerve 1 is olfactory. Then we're going to draw, two eyes. And there's optic. Oops. And then for oculomotor 3, we'll do eyebrows. And 4, we'll do trochlear in the eye as well. While we're here, we'll do abducent 6. Put it on the side to turn the eye. We can't forget about 5. So we'll do forehead. And we'll use him to make our mouth. We already got 6, so 7 is facial. Lost my cursor again. 8, vestibulocochlear. We'll make some good ears. 9, glossopharyngeal. We'll make our tongue. 10 will be our neck for the sensation in our larynx, pharynx. 11, accessory for our shrug. And 12, hypoglossal, put inside of our tongue. Okay, so thank you for joining me in my quick overview of the cranial nerves. I hope this helps.